Now there are some other types of pharmacy known as theoretical pharmacy. That is the theoretical part, that is the official part, that is the theory which doesn't deals with dispensing. That is the theoretical part, how to collect, how to preserve, how to prepare. Okay, these all the types are known as theoretical pharmacy. Now practical or operative pharmacy, how to dispense. So dispensing part, that is the practical part. Okay, also the preparation procedure, these are also some practical aspects. So all these practical aspect or operational aspect are known as practical pharmacy. Next, institutional pharmacy. So some institution may have its own procedure of dispensing. Okay, so preparation procedures are to be uh, maintained according to the official pharmacy. Those countries who doesn't have any official pharmacopoeia, they may have their different kind of preparations or different kind of collection or different kind of preservation rules. Okay, there in these countries, like some uh, like countries of Kazakhstan, they doesn't have any official pharmacopoeia, so they can prepare homeopathic in this country. If any uh, homeopathic hospital established, homeopathic pharmacy established, they can prepare, preserve or collect homeopathic drugs according to their own. Okay, their institution, there may be a separate institution pharmacy, but in India, where uh, official homeopathic pharmacopoeia is there, here we can't make a separate kind of preservation or preparation or collection rules, because these are fixed. We should follow the official homeopathic pharmacopoeia. So where we can make some different arrangement, in the dispensing area. In dispensing, the institution may follow its own rule. In dispensing area, one may follow the rule of giving dry dose, like in sugar of milk, only to be dispensed in sugar of milk. Or they may be form a rule of wet dose, like you have to only dispense in water along with alcohol. Okay, so here official pharmacopoeia like HPI can't set any rule, or official homeopathic pharmacopoeia has not set any rule of dispensing. So it is the here institute can form its own rule. Okay, so that is called institutional pharmacy. Now clinical pharmacy, in the clinical setting, uh, the pharmacy which pharmacy is to be followed is called clinical pharmacy. That is also deals with the dispensing part. Then wholesale and retail pharmacy, the distribution and preservation, stocking, these all the procedures are to be mentioned in wholesale and retail pharmacy. How much wholesale uh, quantity we can preserve, or how much day we can preserve, these all written in wholesale and retail pharmacy. Then ultimately Sphagyric pharmacy, it is nothing to deal with homeopathic pharmacy. It is a concept given by Paracelsus. Okay, here in Sphagyric pharmacy, the drugs, the main component of each drugs have been separated and then again mixed together to used in the disease. Then pharmacopoeia is two types. One is unofficial and another is official. Unofficial is not recognized by government and official is recognized by government. Okay, example is, it is in India, it is Mahesh Bhattacharya homeopathic pharmacopoeia. Okay, and official pharmacopoeia is in India HPI. Next, HPI formation and its volumes. Okay, first it was formulated after independence. There are several pharmacopoeias and several kind of preparation are used. So that is why uh, the eminent homeopaths urged government to form a uniform procedure and an uniform homeopathic pharmacopoeia. Okay, so the government accepted it and form a pharmacopoeia committee, okay, at 1962 under the chairmanship of Dr. B.K. Sarkar. Okay, and after 9 years of work, volume 1 of the first homeopathic pharmacopoeia published. Okay, volume 1 containing 180 drugs. Then 1974, volume 2 containing 100 drugs. Then volume 3 published 1978 having 105 drugs. Hello. Okay, so third volume containing 105 drugs. Now fourth volume, that is an important volume because here the classification of nosodes is given. We will discuss it. In fourth volume, the classification of nosodes is given. So it is coming into the year 1984. Much gapping under from third volume and fourth volume. Okay, and fourth volume, it is into the year total number of medicine here 107. Next volume comes into the year 1987, fifth volume 114 drugs. Sixth volume came into the year 1990, 104 drugs. 1999, seventh volume having 105 drugs. Next year 2000, eighth volume came with 101 drugs. Ninth volume came into the year 2016 having 100 drugs. 2013, the 10th volume coming with 101 drugs. Okay, so pharmacopoeia, what is in a pharmacopoeia? So each unit of the drugs, okay, pharmacopoeia contains the description of drugs. So each drug description is known as monographs. Okay, each drug description is known as monographs. So these monograph contain the name of the drug, their selection method, their history, historical use also, then preparation process, then storage, how to store and preserve them, then caution and reaction. Okay, how to handle, if there is any handling caution is there, we have to mention it, and also the reaction they can cause with air or with water or with any other substances. If any reaction they can cause, we have to write it. It is written in monographs. Next, Ansu's law, that for every substance, small dose stimulates, moderate dose inhibit, and large doses kill. It is known as a phenomenon of hormesis. Okay, it is a uh, proposition actually by Ernst Sulz. Then the physiological salt solution, it's also a proposition by Ringer. It is an artificial solution to be made by salt solution to make the tissue